Hi, I'm Sonia Durai, and welcome to Voices of Somerville. It's a program sponsored by the Office of Somerville Commissions, a program of the Health Department, and our friendly Communications Department. And today we're talking about elder safety and support. And I'm very glad to have Annie Fowler from Somerville Cambridge Elder Services, also known as SCES. Yeah. And Annie is the Director of Clinical Programs, and she's going to be able to give us all the FYI and 411 on what we need to do to keep our elders and our families safe and supported. So thank you for coming.
Yes, thanks for having me. Yep.
So I wanted to first just kind of give an idea about what is Somerville Cambridge Elder Services. Sure. The title pretty much says it, but there's probably a lot more behind the scenes.
Yes, there is more to it, I would say. We've been in serving Somerville and Cambridge since 1972. Our primary directive is to keep elders and older adults with disabilities in the community in a setting of their choice comfortably and safely for as long as we possibly can. We're a private agency, but we have several contracts from the state and the federal government, in particular the Executive Office of Elder Affairs. And we serve, like I said, not only adults over 60, but disabled adults as well.
So younger folks under 60 will also be able to get some services and support from from Somerville Cambridge Elder Services.
Yes, yeah. Our biggest program, which actually only serves right now only adults over that program, we put in concrete services, things like homemaking, personal care, transportation to medical appointments, and the big one that most people know is Meals on Wheels, which is a home-delivered meal 6 days a week. So that's our biggest program.
That's wonderful. Do you coordinate with the nurses, or do you have nurses embedded in your own program?
We do have nurses that work at our agency, but they're mainly to do assessments to determine what services are needed. If someone had a visiting nurse coming in from a visiting nurse association, for example, like after a hospital stay, we would coordinate our services with the visiting nurses and their services, which are, nurses, PT, OT, to make sure that we're complementing services and not duplicating. Also, VNAs are generally short-term, whereas our home care services can stay in as long as necessary.
But the primary goal looks like to keep people happy, healthy, and where they feel the most safe and comfortable.
Yes, exactly. Yeah, we want to keep them in their homes and provide them just the services they need. We don't want to duplicate. We don't want to do anything that someone can continue and likes to do on their own. So if someone likes cooking or likes doing their laundry and they're able to do it safely, we don't want to take that away from them. People should continue to do the things that they like to do.
That's very nice. And how many people, not necessarily exact numbers, but what are we talking about for Somerville? What's the rough idea of your services?
Well, so I was describing our home care services, and we have other services such as just information and referral. We have adult protective services, which I'm going to talk a little bit more about today. And then for the home care program that I was just talking about, probably anywhere from like 600 to 800 in Somerville.
Wow, that's a really large number.
Yeah.
And that's usually one elder, two elders per home. So it's a lot of families that you're helping to stay safe.
Yeah.
And give a lot of support to.
Yeah, exactly. And we want the services also, to be helping the older adult in the home that needs the services, but also to take some relief off of the caregiver. And, an overwhelmed caregiver is often what leads to protective services becoming involved down the line.
Right. I know a wonderful Somerville gentleman who has really said he can't stop talking about how wonderful the services were for him when his partner was dying from a terminal illness. And so he got so much support in how to give care, but also for his own needs. And he was just very, very, years afterwards, and he stayed supportive of your agency. So it's nice to know that there's more support to beyond just the individual, it's to the whole support structure.
Yeah. We like hearing stories like that. But thanks for mentioning that, because we do have social workers who can, just work with a caregiver and, offer training and support, and, more than just the concrete services that I was mentioning if someone did need that.
Right. And so you have the immediate assessments. You have some services that you give, and then you also connect families with additional services.
Yeah.
You give support to and services directly to the caregivers themselves.
Yep.
So you have all of this happening, but sometimes things aren't going exactly the way we are hoping.
Yeah.
And so there's another dimension to Somerville Cambridge Elder Services, and I just wanted to kind of have today's show talk about that other dimension when things aren't exactly working.
Yes.
And how do we give support? How do we keep elders safe?
Yeah.
Can you tell me a little bit about some of the programs you have?
Yes, yeah. So I think, what you're talking about really is our Adult Protective Services unit. And every town and city in Massachusetts has an Adult Protective Services unit that covers that town. A lot of professionals are mandated reporters, so if they ever suspect any abuse, neglect, or self-neglect that they need to report. But we like to encourage family members and neighbors or cashiers at the grocery store to report if they suspect that someone is being abused or they're not taking care of themselves.
Right.
So what I mean by that is there's a few different types of abuse. There's physical abuse, sexual abuse, but there's also emotional abuse, which is threatening or yelling at someone or making them feel unsafe or scared.
Right.
Another form of abuse is financial exploitation. So if someone is being exploited by a loved one or a close relative, that's another form of abuse. And then neglect. So if a caregiver is neglecting the needs of an older adult, by older adult I mean adult over 60, not ensuring that they have their medications if they're not able to get them themselves, not getting them to doctor's appointments, not allowing service providers coming in if the person needs help with things like personal care. And a lot of times, caregivers may be neglecting an elder and they don't even know it. Again, getting back to the what we were talking about, caregivers being overwhelmed sometimes, not able to provide the care that that they need to be. So neglect is another form of elder abuse by our definitions. And then self-neglect. So that's an older adult that's not taking care of themselves and maybe putting themselves at risk of some kind of medical emergency or crisis, or putting themselves at risk of losing their housing and becoming homeless. That's a common form of self-neglect that we see. So
what about like hoarding or other sanitary
situations? So hoarding is certainly something that, if the hoarding is putting them at risk of either injury because it's the unit, the apartment or home has become so bad that they could be injured by the stuff. A lot of times with hoarding, there's fire risks, so that's could be another safety hazard. Or if it's gotten to the point that they're at risk of eviction because they're in an elder disabled building, or the city has decided that it's a public health, public safety issue. Those are certain. Hoarding is a common reportable condition.
And we talked a little bit, and let's kind of hone in on a little bit more about. So we're concerned.
Yes.
I'm the cashier at the grocery store, and I always see this person coming in.
Yep.
I'm worried about the decisions they're making on the shopping, or what they say. Maybe they say something that just triggers my concern.
Yep.
How do I give a flag and what's my confidentiality? I don't want necessarily for this person to feel that there's Big Brother everywhere, but I want to make sure that they're safe.
Yep. That's great question, and kind of a great scenario. So if you're someone that in a situation like that, and if you talk to the person, you don't have to jump to reporting protective services. If you talk to the person and they say, yeah, you know what, I haven't been feeling that well, I really think I could use some help at home, you could call our general information line and make a referral, and a social worker could go out and meet with them and just talk to them about their community options, maybe see their home and see the setting that they're living in, and maybe simple as putting in services in the home or getting them connected to Meals on Wheels. That would be
so something bad's not going to happen to this person.
No, that would be
There's not going to be a police showing up and arresting anybody.
No, and that would be a
probably
great
support.
Yeah, that would be a great scenario. if you were to talk to them and they were to say, I don't need anything, I'm fine on my own, but you still suspect, that maybe you can tell there's maybe personal hygiene issues. Maybe you hear them sort of muttering to themselves. Maybe they seem fearful. Maybe this is a sudden change, that they didn't seem like this when they came into the store or the bank or whatever, a couple weeks ago, and they don't want your help, but you're still concerned. That's when I would make a protective services report. So I would call and say you'd like to make a protective services report. And the protective services worker will lead you through a series of questions and get as much information as they can. It would be hard to take a report without someone's name. But if you didn't have their phone number, some other contact information, we'll do our best to find it. But
Right.
obviously as much information as you can provide is ideal.
What's the confidentiality?
Yep, that's important. So if you were to report, a protective services worker, and at our agency they're all social workers, would go out and initiate an investigation and kind of start to see what's going on. And when they talk to the elder, they will not reveal, they cannot reveal, it's against the law for them to reveal who made the report.
I'm not going to say it was your neighbor. I'm not going to say it's a grocery store.
No.
It's not
No.
not the hairstylist. Won't.
Nope.
No hints.
No, we will not reveal who made the report.
So giving the name is really for the background for the social worker to check in, because maybe your concerns aren't apparent, but they want to make sure that they investigated your concerns.
Yes.
So that's usually what the contact information is for.
Yes.
It's not to give to the
No.
family to say this is who's saying you're hurting your mother.
No, because oftentimes, the reporter may be one of the few people that this individual has regular contact with, and we don't want to sever or break down that relationship in any way. And if an elder, some elders are perfectly fine with us reporting, and they know that they need the assistance. Others may not be happy that a report has been made, and we don't want to, do anything to hinder the relationship between the reporter and the elder, especially if they have become, somewhat isolated.
Right.
Yeah.
And so now we have protective custody is involved, and you already kind of said a little bit. So there's going to be an assessment. What are some of what's the few steps that we can kind of see? The most important thing is getting out to the elder's home, seeing the home, talking to the individual. One of the first things we want to do is get a sense of if they have capacity, if they have the capacity to make decisions for their care. So we want to know, do they understand, the risks of living the way that they're living? Do they understand the risks maybe of not going to the doctor on a regular basis, or living in a situation where there's hoarding or infestations of some kind? And if they understand the risk and they say, I know that it's not necessarily safe to live this way, but I understand it and this is how I want to live, they're an adult and they have the capacity and the ability to make their own decisions, protective services will step out. If in that initial visit we get the sense that maybe they don't understand the risks, maybe we're getting the sense that there's some mild dementia or some kind of mental health issue and their capacity is in question, then we would stay involved longer. We would probably see if we can get permission to talk to other family members or providers. We would want to talk to the primary care physician if there's one involved. If they're in an elder housing building, we would want to see if we could talk to the resident service coordinator or social worker or building manager to just get a full picture of what exactly is going on here, what are the risks, how long they've been going on, what has been tried, to see if there's a way that we can really get to the root of the issue and help the person fix that situation. It's a tough one. If you have somebody who doesn't see the scope
Exactly,
of how this is actually something that's maybe treatable, that this is something that we can improve and you'll find an uplifting result if you can get in, but the person they're saying they understand this is not a good situation, but I'm going to live with it because fixing it is too big of a problem. How do how do you or can you help them feel empowered to move forward, or is that a different service that this is not really your scope?
No, I think, that is one of the, we aren't trying to fix the problem for them. We are trying to work with the clients to help them be able to fix the problems on their own and maintain, whatever, especially in these situations we're talking about where there's eviction risks, maintain whatever it is in order to maintain their housing. If we get the sense, I think you were sort of alluding to this, if we get the sense that their capacity might be in question, but it's hard for us to tell, because sometimes people are very good at during, certain pieces of their lives, and they've been doing the same thing, day after day. Maybe they eat the same meal 3 times a day, or maybe they have a really good system for paying their rent and paying their bills, but other things seem to have sort of slid. We can also bring in psychiatrists. We have good relationships with local psychiatrists in the Cambridge Health Alliance to do a more thorough capacity evaluation. So then we can have a better sense of exactly what this person's capacity is to understand the risks and where exactly should we be intervening.
I want to just kind of talk a little bit more about maybe some individual case examples.
Okay.
Of, do you have a scenario of something that kind of helps us show what might happen to an individual?
Yeah, sure. Okay. So here's an example of a woman. She was living in her she was living in Somerville in her mid-60s. She was in an elder disabled building, meaning it was this was a public building, so it was overseen by the Somerville Housing Authority. I think the social worker in the building reported to Protective Services that she was at risk of eviction because, as we were talking about, she had some hoarding tendencies, and there was an infestation of bed bugs. So, that's an unsafe situation for the housing authority, and they're often, when situations get really bad, they're often sort of forced to think about eviction. So this person was at risk of eviction. The report was made. The Protective Services worker sort of served, and the woman was agreeable to working with Protective Services. So the Protective Services worker sort of worked with the client and the housing authority as sort of a mediator, and was able to extend the eviction risk, and was able to work with the client on identifying what she would be agreeable to getting out of her apartment to decrease the clutter. They kind of worked on that slowly. The Protective Services worker made a referral to the home care program that I was talking about earlier, and home care was able to bring in heavy chore services. And heavy chore, they kind of come in and clean out a lot of clutter and trash. And the woman hadn't been agreeable to that in the past, of course, because these were her belongings, valuable, stuff, and she was afraid of losing it. So with the help of the Protective Services worker, she was able to let go of some things. She had a better understanding of the risk that her housing was at and what losing her housing would mean. So she was able to get her apartment to a point that they could bring in extermination to work on the bed bug issue. And in the end, she was able to keep her apartment less cluttered, obviously not live with bed bugs, which is a good thing, and have regular home care services, homemaking, to maintain the apartment at the level that it needed to be maintained. And then the Protective Services worker also made a referral to a therapist so she could work on, some of the behaviors around the, kind of need to collect things, which is, hoarding is now seen more as a mental health issue. So it's not just, you can't just come in and take the stuff out of the apartment. There needed to be some kind of ongoing long-term work for this individual to maintain the apartment at the level it needed to be.
And so in the end, she was able to keep her home.
Yep.
Raise the level of health safety to a good, productive, sustainable level.
Exactly.
And there was maintenance of services, and Protective Services was able to withdraw a little bit and not have such hands-on. Once it was started, once the situation resolves itself, you'll be able to kind of pull back a little bit.
Exactly, yes. And protective services is considered a short-term intervention, even though we are often involved for a few months because these are not easy situations. But the idea is when the safety risk is alleviated, protective services would close the case. And usually when they close the case, they want to make sure that there's a long-term plan of care in place. So in closing the case, it often involves making referrals to other agencies that can stay involved more long-term.
So it's a little bit different than child protective services, because child protective
Yes.
services, you'll assume most children will age out and become independent. And in elder protective services, there's a different scenario. There may be different kinds of services that'll continue to be brought in as needed.
Yeah. And again, it comes back to the self-determination. If someone has capacity to make their own decisions and they're not, and they've gotten to the point that they're making good ones, we want to assume that they're going to make decisions and live the way they want to live going forward.
Which is exactly what your mission is
Yes.
to let people stay in the place that they want to be, independent and healthy and happy.
Yeah, exactly. Right. And I think that's another good point. That's the mission of our agency, and it's also the mission, of course, of the protective services. And I think sometimes people may not make reports, or people may not self-report because they think protective services, their goal is to put me in a nursing home.
Right.
And that's not. We want people to stay in the least restrictive setting safely. And if the community can be the least restrictive setting, that's where we want them to stay if that's what they choose.
Right. So let's look a little bit into situations of abuse.
Okay.
And so we know some of the more typical known examples, but there are different kinds that people are not familiar with. So why don't we look at some of the ones that people aren't as thinking that's considered abuse, or I didn't even realize that that's a risk area.
Yeah.
So talk about some of that.
So I think a big one is emotional abuse, and like I said earlier, oftentimes that's in the form of threatening, and it's might be an adult son or daughter threatening to put their mother in a nursing home. If you don't do this, we're going to put you in a nursing home, or threatening to not let their workers in the house. That's another form of abuse, and it's also denying access to needed caregivers, which is another form of abuse. But so yeah, emotional abuse would be the threatening, yelling at an older adult or an individual, just yelling a lot in an apartment, even if it's not necessarily directed at the person, if it's to the point where the individual is feeling scared or fearful that they're going to get hurt in some ways.
What about the just mental happiness? So
Yes.
Not only fearful, but this is significantly impacting an emotional.
Yeah.
Like it's just it's creating a negative atmosphere. Is that part
mental suffering is because we know now that sort of our emotional health and our mental health is very connected to our physical health. So if someone is suffering from mental, kind of mentally or emotionally because of caregivers, loved ones in the home, that could be a reportable condition, and that's kind of gray. It doesn't mean like if you have an adult son or daughter and they have a chronic illness and you're helping with their care, but they're not really threatening you in any way. That isn't necessarily emotional abuse, even if someone is sort of mentally suffering. Doesn't mean that they don't need some kind of help. It just may not be reportable.
It's not protective services.
Yeah, it's not protective services, but it could be services from our agency.
Right. So that's what the assessment process is for.
Exactly.
So
yes.
If you're feeling that someone's having a difficult time, what if it's my sibling or it's a close family connection and I'm really worried about how this is working, but I don't know what exactly the problem is.
Yeah.
Protective services is a great start to have someone kind of do that assessment, and
yes.
something will be able to begin.
Yeah.
Whether or not it's requiring protection.
Yes. Although I would say that if you are a 75-year-old woman who's, single or widowed and taking care of your sister who has a chronic illness or is terminally ill, and she isn't necessarily being emotionally, or mentally threatening to you or yelling at you or anything, but just her care is completely overwhelming you, it wouldn't necessarily be protective services, but you are legitimately an older person who's providing care and is, you having some caregiver stress. So in those cases, I might start calling our agency's general information line and talking to one of our social workers, and they'll help determine if, someone should just go out and do an assessment for services or if a protective services report should be made.
So these are all ways to start getting
Yes.
into the problem without feeling that these are negative.
Exactly.
What you're doing is not negative. You're asking
Yes.
for help, which is a very positive step.
Yes.
It's recognizing someone's overwhelmed.
Yep.
Or maybe someone is bullying or
Yes.
abusing, and these are all good things to recognize.
Yeah.
And again, the confidentiality is there.
Yep.
For the reporter.
Yep.
So no matter how close or how far away they are from the situation, they can ask for someone to give support to this family.
Yep.
Right?
Yeah. Yep.
And so we also talked about, so we've got bullying, we've got emotional, we've got restricting support, restricting medicine, maybe restricting bathroom use,
Yep.
then there's financial.
Yeah.
And so there's a variety of things that might be able to put brakes onto the situation.
Yeah.
How does protective services get involved financially?
So again, financial exploitation is unfortunately fairly common, I think, reportable condition that is reported. And that would be if it's generally when an adult son or daughter has access to an older adult's money and is spending it, in ways that more benefits them, or is not buying things for the individual with their money, and then they aren't able to afford the things that they need, like their rent or bills or, medications. It can also be, and this is sort of when, one of the statistics in elder abuse is that when there's one reportable condition, there's usually more.
Yeah.
So there could also be situations where the elder has capacity and handles their own money and is giving money to a son or daughter because the son or daughter is either saying that they can't live without it, or they're threatening them, if you don't give me this money, I'm going to do this, So those are situations where there's financial exploitation and the emotional abuse that we talked about earlier, or
Which
the
is
bullying.
Often in any kind of abusive situation that there's either a cycle of it where one will fade and another one will take over. Maybe, it's not always a financial drain, but it might be financial drain, and then it might be emotional abuse, and could be, it's a cycle of it.
Yeah,
right?
exactly.
So,
Yes.
but getting that call to protective services is the place to get the beginning of the assessment going.
Yeah.
Right.
Yep.
So,
exactly. Yeah.
So we have been covering a lot of topics here. We've talked about the mission of Somerville Cambridge Elder Services. We've talked about some very robust programming that the agency does. What are some final thoughts that you'd like to leave everybody with when thinking about how to keep our elders safe in our community and our families?
Yeah, I think the key is that if you think that there is something that seems strange or you're concerned at all, the place to start is to just call and consult. Just call and say, what should I do in this situation? And just, get some feedback. The other thing is we don't want people to feel like they're alone with this. If you know someone who you think might be being abused or neglecting or self-neglecting, we don't want you to feel like, you as a neighbor or you as a bank teller have to, deal with this or know about this and not do anything about it. We want people in the community to feel like they're getting support. So if you have any questions or concerns, I would just encourage to call and do a consultation. That's the I would say the number one takeaway.
So that's really good. So Somerville Cambridge Elder Services is a program that is here for us, for our families, for our neighbor down the street, for the customer that comes into the store, and the church member, the person who comes to the mosque. That's what they're there for. Yeah. And so it's someone that we can lean on and get support for. So I want to thank everybody for joining us here at Voices of Somerville, looking at elder support and safety with Annie Fowler from Somerville Cambridge Elder Services. Please look for our displays that'll be at the library. We've got a blog that we'll be putting out. We've got Facebook, and Somerville Cambridge Elder Services has a website and a phone. They've got a front office that you can make appointments with. So there's lots of ways to get information and lots of help. So check us out online, check us on by phone, and thanks for joining us, and we'll see you next time. Thanks to the communications too.